Hello and welcome to French Philosophers React, a philosophical take on the news headlines for today, August 24th, 2024. This is an AI-generated podcast and can make mistakes. Use it for generating possible ideas, but don't rely on it as an authoritative guide to the news or to the details of French philosophy. In the news today, the U.S. Centers for Disease Control and Prevention, CDC, reported a 1% decline in early and adequate prenatal care among pregnant patients in 2023, with 76.1% of women receiving first trimester care compared to 77% in 2022. This marks the second consecutive year of decline, with a 5% rise in patients receiving no prenatal care at all. The trend is attributed to various factors, including maternity care deserts, hospital closures, and poor reimbursement rates for obstetrics services, particularly in conservative rural and southern states. Despite this, maternal mortality rates have begun to decline from their mid-pandemic peak. So, what might French philosophers have to say about this news item? The decline in early and adequate prenatal care among pregnant patients in the U.S., as reported by the CDC, bespeaks a deeper malaise afflicting the very fabric of our society. As Michel Foucault would have it, this phenomenon is not merely an aberration within the healthcare system, but rather a symptom of a broader cultural and economic context that valorizes certain forms of power and knowledge over others. In his seminal work, The Order of Things, Foucault 1966 argues that modern society has given rise to a new form of governance, one that is characterized by the emergence of novel epistemological formations and the concomitant suppression of older, more marginalized ways of knowing. This process, which he terms the episteme, denotes a profound shift in the way we understand and interact with the world around us. In the context of prenatal care, this episteme manifests itself as a valorization of efficiency and productivity over the needs and well-being of pregnant individuals. The fact that 5% more patients received no prenatal care whatsoever in 2023 suggests that certain segments of our society are being systematically denied access to the very services they need most. This is not merely a matter of resource allocation or institutional neglect. Rather, it reflects a fundamental disregard for the human costs of late capitalist development. Foucault's notion of power knowledge, 1977, provides a useful framework for understanding this phenomenon. In his analysis of the social and economic structures that govern our lives, Foucault reveals how certain forms of knowledge and power are intricately tied to the exercise of control over others. The rationing of prenatal care in 2023 serves as a stark illustration of this dynamic. Those who possess the necessary resources and privilege, e.g., insurance coverage, are able to access the health care they require, while those who do not, e.g., low-income individuals living in maternity care deserts, are left to suffer the consequences. Moreover, Foucault's critique of modernity as a cultural and economic regime that values progress and innovation above all else is particularly relevant here. The prioritization of telehealth prenatal care solutions, Williams, 2024, represents just such an example of this dynamic. Rather than addressing the root causes of inadequate prenatal care, namely poverty, lack of access to healthcare resources, and systemic inequality, policymakers opt for quick fixes that merely mask these underlying issues. In his essay, What is Enlightenment?, Foucault, 1983, reflects on the very notion of progress itself, suggesting that our vaunted commitment to human betterment is often predicated upon a flawed understanding of the world and its workings. The same can be said of our approach to prenatal care. We are content to tinker with existing systems rather than fundamentally rethinking our priorities and values as a society. Ultimately, the story of declining prenatal care in the U.S. serves as a powerful reminder that our collective well-being is inextricably tied to the social and economic structures that govern our lives. By examining this phenomenon through the lens of Foucault's philosophical ideas, we are able to see beyond the surface-level statistics and policy debates to reveal a deeper truth: that our society's commitment to late capitalist development comes at a terrible cost, one that is paid in full measure by those who need our care most. Thank you for listening to today's episode of French Philosophers React. Be sure to come back tomorrow for more reflective takes on the day's news.